Hello everybody, welcome to your instructional video on how to perform an ECG. I'm Jennifer, hope you're enjoying your upskill, and as you know, an ECG is the short version of electrocardiograph. I'd like to introduce you to Frankie. He's my patient today that's very kindly volunteered, and I've already washed my hands and have my PPE on. I'm going to wipe Frankie's chest with some alcohol wipes, and these are the electrodes that you place on the patient. Be mindful too, when you have the electrode cord in there, the probe, you can actually twist these so it takes the weight off the electrode. Okay, once the patient's laying down and comfortable, always make sure the left hand side of the patient is beside you, then you've got the heart and it's easier to place the electrodes on your side. It's very important also is to get the patient's permission to perform the ECG. So as you can see, I've just gently pushed Frankie's shirt up, having my alcohol wipe. Just pop under. We can always work around the shirt. I'm just going to pop the alcohol rub there on his chest. Get a new one. Do the opposite side. You'll understand why in a moment when I place the electrodes. And what we do is just wipe underneath the breast there, just like that. Just to make it easier for viewing for you, I have removed Frankie's shirt, but when you're dealing with a real patient, please don't do that. You can always work underneath, coming from the top, and you can always work around a lady's bra. So please don't remove their clothing at any time. Now I've placed the first electrode here, which is the fourth intercostal space, which is the space that's in between the ribs. So you go 1, 2, 3, 4, and you place your electrode just there. So now I need to place another electrode on the opposite side of Frankie. So we're going to just feel the collarbone there. 1, 2, 3, 4. And if you actually practice on yourself, you can feel exactly where the spaces are. Okay. Now, that's number 1 and number 2. Number 3 goes on the fifth intercostal space, which is just here. So we place the electrode just there. Number 4 goes straight underneath the patient's nipple. So with Frankie, his nipple is there. So we're just going to feel, that's the space there, and we're going to put the electrode there. We have 2 more to place, just a little bit beside. Make sure it's in the 5th space, and then this one just circles around a little bit, and that's how it is. As you can see, I've placed the probe from the ECG machine into the electrodes. Number 1 is always on the right hand side of the patient, and then you just follow the numbers. We've got 2, 3, here's number 4. Now when you put the probe in, you just pop it in like that, and you can see this little expanded area here. What you do is just push him in, just gently like that, till the probe is in. So that's number 4. Here's number 5. They are colour coded as well to help. And number 6 is purple, so I'll just pop him in. And it's just a gentle twist, that's all. Freddie's now all hooked up for his ECG. I've also popped his right arm placement, which is 5 centimetres from the wrist. So you're actually looking at this space here is where you would put it. The left arm is matching. And we have right leg placement and left leg placement. It's about 10 centimetres from the patient's ankle on the inside of the leg, not on the outside. So then what you would do is put all of Frankie's information into the ECG machine and ask the patient to lay relaxed, don't talk, breathe normally, and then the ECG reading will be done. Okay. With your referencing material on how to place the ECG electrodes, you do have this in your training book. I've coloured the ribs on the left hand side in red to make it easier for you to see. And as you can see, this is the main side that you're working on because this is where the patient's heart is. And that's in reference to our friend here. And you also, in your collection rooms, you will always have this document on the wall. This is just to help you make sure you place the electrodes properly on the patient. Now Frankie is all set up with his electrodes and leads on. The patient now stays nice and still, breathes normally, and doesn't talk. It's very important because all of that will upset the ECG trace. This is the machine that you'll be placing the patient's data in, which we will be talking about in the next video. And I'll also be showing you how to perform a trace. Once the ECG has been performed, if the doctor requests, you can actually print a trace of the ECG to give to the doctor. That's so the doctor knows whether he's sending the patient to the hospital or not. We'll be doing that in the next video. So after all that's done, we then remove all the electrodes from the patient. Make sure there's no sticky bits. Sometimes we use a little bit of alcohol, or always have a tissue in your hand just to wipe the gel away from the patient and gently assist the patient sitting up. Sometimes their blood pressure gets a little bit funny, and don't let them rush. Be careful getting them off the bed, and then the ECG's been done, report gets sent to the doctor, and it's all good. Frankie can go and enjoy his day. Okay. This is Ruby, Frankie's wife. She's come in to have an ECG done as well. I've just placed the electrodes on just so you can see how you can work around a lady's bra. The electrodes are placed exactly the same way on a man and a woman, also a child, but you do not have to remove the bra to work around and to perform an ECG on a lady. Thank you, Ruby. And Ruby has brought little Sophie in. This is Sophie, and I've just popped her electrodes on as well. Excuse me, Sophie. As you can see, with a child, you need to make the electrodes a bit smaller. And with a child, it's very important, of a child under 18, number 4 electrode, after you've done your first ECG, you place another one straight under the nipple there, which is number 4 on the reverse side, and you need to do another ECG. And in the clinical notes on the machine, you actually write that it's a reverse 4. So then the people reading the report and writing the report will know which ECG is which. Hope you have a great day. Enjoy, practice and practice and practice your ECG electrode placement, and once you've got the hang of it, you'll have no problems at all. Take care.